Care Karen. I love being a nurse, and I have a passion for wound care. I want to inspire nurses, educate patients, and have a little fun along the way. Today is our first episode, and we are going to talk about hyperbaric oxygen therapy. My guest plays Thor, the god of thunder himself, straight from the MCU universe, introducing Chris Hemsworth. I'm sorry? What? He can't make it? Oh my gosh. Okay. All right. Well, this is my first podcast. There was bound to be a few hiccups. Okay. Hang on. I've got an idea. Okay. Ladies and gentlemen, I'm proud to introduce my first guest, my coworker, Patrick Escamilla. He stopped by to wish me well on my first recording, and it seems he's willing to help a girl out. Thank you so much, Patrick.
Oh, yeah, no problem. I just, thought I was going to help produce this thing and meet Chris and get some autographs, but oh well.
Okay, well, thanks for being so understanding. So let me introduce you to our audience. Patrick Escamilla, you are an LVN. That means you're a licensed vocational nurse in the state of Texas. You are a CHT, that's Certified Hyperbaric Technologist. Okay, that tells me that you took extra training, you took a very big test, and every year you keep up on continuing education to maintain that certification. Awesome. You're also a CWCA, a Certified Wound Care Associate. Okay, that tells me that you also took more training in wound care, you have experience, you took another big test, and every year you maintain extra education in wound care. Is that about right? Okay. Wow, lots of letters. That's impressive. So you were one of the first people I met when I moved to San Antonio in 2005.
Yes.
We were taking our introductory course in hyperbaric oxygen therapy. So let's just start off. Can you please explain hyperbaric oxygen therapy?
Yes, hyperbaric oxygen therapy is where doctors use oxygen as a medicine. So usually when we think of oxygen, we think of, oh yeah, that's the air that we breathe and blah, blah, blah. But it can actually be used as a medicine in concentrated forms. So right now, all of us, if you're just minding your own business, listening to this podcast in your room, you are breathing 21% oxygen and you're breathing 78% nitrogen and less than 1% of all the other gases combined. So that's crazy. I didn't know that. I thought, oh, it's 80% oxygen, until we started studying, until I found this out. And that's the way it is throughout the world. That's just the mixture of air. That's all the gases combined is quote unquote air. Mm-hmm. So hyperbaric oxygen therapy is when they put a patient in a chamber and they compress that patient with 100% oxygen. So now we're using it as a drug, as a therapy. And so there's two types of hyperbaric chambers. The first one is a monoplace chamber, and that's where you put one person inside the chamber, you shut the door, lock it, and you compress them with 100% oxygen. Then you have what's called a multiplace chamber, and that's a little bit bigger chamber. The monoplace chambers are usually, they're probably about 10 feet long. They're maybe about 4 feet in diameter. There's usually an acrylic shell that goes around so you can see around. Pretty much your view is not so obstructed. There are some monoplace chambers, however, that look more like a steel bullet, if you would, and there's little portholes that you can look out. But most of the chambers here in the United States, at least, are the monoplace chambers have this acrylic, so you can see outside. You can see all around you pretty much. Then you have another type of chamber, which is called a multiplace chamber, and that's more of the Nautilus type of thing, when you see submarines and when you envision like a hyperbaric chamber. It's a big metal room capsule. You can fit 4 4 people up to about 12 people in this room, in this big chamber. There's big clanky doors. You can walk in. Patients that get in there, they can either lie down or they can sit down or stand up in there. There's usually plenty of room in there. And those chambers are compressed with air. So you're getting compressed with 21% oxygen, 78% nitrogen. Trick to that is, though, you have to put a hood over your head or a mask on your face that's going to deliver 100% oxygen under pressure. So the way it works is we pressurize a patient in a chamber, and under a certain amount of pressure, the oxygen molecules start to infuse into the bloodstream, into the plasma or the water part of the bloodstream. So why do hyperbarics? What's the big deal? Why can't you just put a oxygen mask on and breathe oxygen
Why isn't that the same?
Because there's some physiological attributes to putting someone in a chamber and compressing them with pressure to force the oxygen molecules into the bloodstream. So the way the body works is, the way you breathe, the way you live, is that when we breathe in air, we breathe in oxygen molecules. They go into our lungs. They go into little sacs called alveoli. There's little tiny capillary blood vessels in there. The oxygen gets filtered into the bloodstream, into those capillaries. And then we have red blood cells in our body. And the red blood cells act like little roller coasters. So the oxygen molecule jumps on that red blood cell. That red blood cell carries the oxygen molecule throughout the body, through the arteries and the veins. Then it deposits that oxygen molecule to a cell, and then the cell takes in that oxygen molecule with glucose, and then it metabolizes it, or it burns it. And then the byproduct is carbon dioxide.
Okay.
And the cell spits that carbon dioxide molecule out. Well, it jumps on a red blood cell, like a roller coaster ride. And then that roller coaster, that red blood cell takes it back to the lung. Then in the alveoli sac, that carbon dioxide molecule jumps off, and then you breathe it out.
Breathe it out. Okay.
And then you breathe in. And it's just it's a cycle. It just happens over and over and over and over. Well, you're only as good as how many red blood cells you have.
Right. That sounds very dependent on your red blood cells working.
Yes.
And you having plenty of them.
Yes.
Okay.
So that's why when they say people have anemia, they have low red blood cells in their body, and they seem to get tired when they walk up steps, or
short of breath. Right.
Because they don't have enough red blood cells to carry oxygen molecules throughout the body. So the magic of hyperbarics is another example that I use with my patients is that I tell them it's like if you're at a water park and you have a lazy river, and the lifeguard will not let you get into that lazy river unless you're on a inner tube. And so, during the summer at these water parks, there's thousands of people there. The inner tubes get all taken up. So there's all these people floating in this lazy river, and then there's hundreds and hundreds of people in line waiting for the people to get out of the lazy river so they can grab that inner tube, jump on it, and get in.
So the inner tube is the red blood cell.
The inner tube is the red blood
Wait
cell.
on red blood cells.
Right,
okay.
right. And then all of a sudden, the supervisor comes and he asks the lifeguard, "Hey, what are you doing?" And the lifeguard's like, "Well, these people are in line." And he's like, "Yeah, I know, but I'm getting complaints, and look at all these people been standing in line for an hour. Just let them in. Just let them all in, and they're just gonna have to swim and wade in that lazy river." Okay, so he starts letting everybody in, and woo! They're jumping in and splashing. And now there's thousands of people in that lazy river. There's more people wandering and wading in that lazy river than there are people on inner tubes. That's just what happened with hyperbaric oxygen therapy. We compressed a person to a certain pressure, and we forced the oxygen molecules into the bloodstream. So they don't need the red blood cells to carry them around through the blood vessels anymore.
They can just float in the plasma.
Yes.
Anywhere plasma goes.
Yeah, and the plasma...
They don't need the inner tube anymore.
Correct.
That's Fascinating.
The plasma is kind of like the watery part of your blood, if you will. So those oxygen molecules can swim about. They're hundreds more times concentrated, the oxygen in someone in a hyperbaric chamber, than you and I, or the people just breathing regular air at sea level.
So the way it works then, and I think this is a big misconception, is then it's simply by breathing it in.
Yes.
It doesn't soak into your skin or dissolve into the wound.
No, it doesn't penetrate through. It might penetrate very, very little microscopically.
Right.
But the way it works is you have
simply
to
breathe
it in.
Okay.
So your whole body has to be inside a chamber.
Okay, because I do, sometimes I watch NFL and you see on the sidelines and they say, oh, so-and-so's knee got hurt, and they show the sidelines and he's sticking his leg in a little bag, and it says he's getting hyperbaric oxygen on his knee so he can be fit for the next quarter. Is that hyperbaric oxygen?
No, that's not hyperbaric oxygen, unfortunately. The FDA has approved devices like that, so you'll see them. I've seen patients that with like a diabetic ulcer or something, and they've stuck their foot in this plastic plexiglass box, and it has oxygen concentrator or oxygen tank piping oxygen into that box. And they call it therapy, but right now the research just is not there.
Yeah, because it takes the baric part out of it, right? There's no hyperbaric in that.
Right.
So
there's hyperoxygen in there.
Yes, right. So it's topical oxygen therapy. Which is a separate thing, right? So when we talk about hyperbaric oxygen therapy and what you and I do, we're talking about placing the entire patient in a chamber.
Yes.
Or even multiple patients in a multi-chamber. Okay. Awesome. And I love etymology, so I like to break down words. Hyper meaning over or extra.
Correct.
And then baric from the Greek word baros, meaning pressure. So over pressure, hyperbaric oxygen therapy.
Yes.
Okay, awesome. So that helps dispel some of the misconceptions I've heard. Okay, but we're dealing with oxygen, we're dealing with a high amount of pressure. That sounds dangerous to me.
It can be, yeah.
Talk to me about some of the safety measures, some of the dangers, and then the safety measures.
Okay, probably the number one danger is fire risk.
Right, 100% oxygen.
100% oxygen. Now, oxygen is not flammable. Okay, a lot of people think, oh, oxygen's flammable. It's not. Oxygen is needed to support the flame. So, whenever you have a grease fire in your kitchen and they just say, get a lid. And
smother it.
Yeah, just put the lid on top of that pan. It's going to smother it so that fire will not get any more oxygen and it'll burn out on its own.
Okay, so it's necessary for a flame
combustion.
Or ignition. Combustion,
right.
Thank you. But it is not it's not
the fuel.
Right.
No,
okay.
no.
Okay.
So when you have patients get into a monoplace chamber, that's giving them, and I'll go into this in a little bit detail between the monoplace chamber and the multiplace chamber. So when you get a patient into a monoplace chamber, they are getting pressurized with 100% oxygen. So anything that goes into the chamber has to be scrutinized. So there's a lot of prohibited items. There's no anything that it's an ignition source. So no cell phone, no lighter, nothing battery powered.
Okay, no battery, nothing with a battery.
No, nothing.
No hand warmers.
No hand warmers.
Okay.
Can go in there.
Nothing that can produce heat or spark or any type of
flame,
ignition.
Yes, because that's going in a highly oxygen-enriched atmosphere or environment. That's just a recipe for destruction. So the fuel would be the sheets, the gown, the person themselves.
Right, the pillows.
Yes.
Yeah.
So we have to scrutinize everybody that goes in there. So when people come into the clinic, we make sure that they don't have any alcohol-based, petroleum-based products on, no makeup, no deodorants, anything like that, cologne, aftershave, perfume, none of that stuff. So we just say, come bare, all natural. And then we have to have them change out of their street clothes and put put on special hospital gowns that have at least 51% or more cotton fibers in the material is the safest. Man-made fibers are iffy, so we don't like to have rayon or
right,
nylon or
right,
lycra or anything like that. Polyester.
Right.
That was 1972.
Okay, so that would help mitigate the fire risk, but pressure, a lot of pressure can cause safety concerns, right?
It can. Barotrauma is just any trauma that's caused by pressure.
Okay.
And the most susceptible part of the body to pressure is your eardrums. So if you've ever been in an airplane or you've been in the mountains or even swimming, if you dive down to the deep, you feel that pressure on your ears and you have to pop your ears, quote unquote. You have to just swallow or yawn or pop your ears to equalize the pressure. So what you're doing is we have eustachian tubes that go from our middle ear to our throat, and when you stretch and you yawn, you open those tubes and that equalizes the pressure. If not, the pressure will just keep pushing and pushing on your eardrum, and eventually it'll bust, it'll rupture it. And we don't want that to happen. Other types of barotrauma could be if you have a filling in your tooth, there might be an air bubble in there. You can feel, they call it a squeeze, and you might have a toothache.
And that's usually if they've had recent dental work, right?
Recent.
It's not, we're not talking about old fillings.
No.
We're talking about recent, I just had a cavity filling yesterday. So
Right,
it's recent dental work.
Yeah.
Might be a tiny air bubble in there. Yeah, gotcha.
That and if you have sinus congestion. So if you go in there and you feel stopped up, and we've all had that where you can't hear, and you're like, I got a head cold.
Right, because it's all connected. Your ears with your sinuses, with your nose, and with your mouth.
Yes.
They're all connected.
They're all connected, right? And so wherever you have an air bubble inside your body that is isolated, the pressure from the outside can affect that air bubble. It can push on it and make it smaller. Or when you're decompressing, it can expand and push on the tissues, and that could be a problem. So that's a risk. So we want, if you're sick, you may not be able to dive if you cannot clear your ears.
And when we say dive, we mean have a hyperbaric treatment.
Yes, I have a hyperbaric treatment.
It's an old term because hyperbarics is used to treat decompression sickness in scuba divers. So sometimes we slip and call it a dive.
True.
And then also, I'm sorry, we might have been saying HBO. Sometimes we shorten hyperbaric oxygen and call it HBO also. So
HBO,
those are little
hyperbaric oxygen.
Colloquial terms you might hear Patrick and I say. So yes. Okay, so fire risk, barotrauma risk. What about oxygen toxicity?
Oxygen toxicity can occur because sometimes our body's not equipped to being 100% oxygen exposed under pressure.
And this is fascinating to me. I remember learning this in nursing school, and I didn't realize that. I thought, we breathe oxygen, so the more the better. Right?
Not necessarily.
I remember first, I think I learned about water toxicity. I thought, wow, how can someone have too much water?
Right.
And then I had a patient that had that. Oh, wow. But yeah, oxygen toxicity. There is such a thing as a human getting too much oxygen.
Yes.
Because you're right, we're not designed to have this much. So what does that look like? And then how do we mitigate that? How do we prevent that from happening? Because we're putting them in 100% oxygen.
We are. Let's talk about oxygen toxicity.
Yeah, what's it look like?
Okay.
So if someone is becoming oxygen toxic, meaning having too much oxygen in their body, how can you tell as the attendant?
Usually you see twitching in the face. You might see them with a blank stare. They might slur their words. They might start to become rigid. They may say that they hear different sounds, like a ringing in the ear, bells. They might see flashes of light.
Okay, these all sound like brain,
Yes.
so it can affect the brain.
Yes, it can affect the brain.
Okay.
And the spinal cord.
Gotcha. So how do we mitigate that? Again, we're putting them in 100% oxygen under pressure.
The way that we mitigate that is that we give them what's called an air brake. So we put a mask inside the chamber and they breathe through a non-rebreather mask. They just breathe regular air. the air that you and I are breathing right now.
Okay, so the chamber itself, we're pushing 100% oxygen into.
Correct.
And the patient's in there. And then about half hour, 60 minutes, whatever, we say, okay, time for your air break now.
Yes.
And we have them put their own mask on, and then we turn on the medical air.
Yes, we have cylinders that have medical grade air, which is 78% nitrogen, 21% oxygen. And so we give that to them and we let them breathe for 5 to 10 minutes. And what that does is it drops the levels of oxygen in their body. It brings them down. Because what's happening is, remember how I said whenever we're breathing and the oxygen molecule goes into the cell, it metabolizes and it spits out a carbon dioxide
Right,
molecule.
gets exchanged. Yes.
Yeah.
Right.
Okay, there's other byproducts of that metabolism. So there's a lot of what we call free radicals, and that's just part of the process of metabolism. And these free radicals get built up in the cells, and there's a bunch of different enzymes in those cells that help break those free radicals down and keep the free radicals under control. Well, when you're flooding the body with hundreds and thousands of times more oxygen, what's going to happen? You're going to have more metabolism that goes on. So
Yeah, your body has to work harder.
yes, it works harder.
Okay.
And so more carbon dioxide is going to be released and more free radicals can build up as a byproduct of that metabolism. And there can be at some point where the enzymes inside the cell just can't handle the free radicals, macrophages and stuff like that cannot handle the breaking down and controlling those free radicals. And at some point, that's when the oxygen toxicity seizure can occur.
So it can lead to seizure.
It can lead to seizure.
Okay.
Yeah.
That doesn't sound pleasant. Okay. And so another way we mitigate that also is we limit the amount of time that they're in the chamber.
Yes.
And of course, that is all decided by and prescribed by the doctor.
By the doctor,
depending on the patient's health, depending on their
on a diagnosis,
their condition,
yes.
which we're going to talk about next. Yes. Okay.
And the amount of pressure too, because the more pressure that you give someone, the more you put them at risk for barotrauma and for oxygen toxicity seizures.
True.
So in using hyperbaric oxygen as a medicine in treating, usually there's certain pressures and they can be equivalent to certain depths. So so let's say that I can replicate hyperbaric oxygen therapy in the ocean. So I could get someone to put on a mask and give them 100% oxygen through that mask. And if they dive in the ocean, if they go down 33 feet, that would be the equivalent to doubling the atmospheric pressure on the shore. And then if they go down 45 feet, that would be 2.5 times.
Okay.
And then if they
And those are the commonly when we treat hyperbaric patients for wounds,
right,
we often give them double the amount of pressure or 2.5 times the amount of pressure,
Right.
up to 3.
up to 3.
Right. Okay.
And that's in a monoplace chamber. Usually it can only go to 3 times the pressure of being at sea level. Now, a multiplace chamber, that can go much, much deeper or provide more pressure. And they use those sometimes for divers, and we'll get into the reasons that we use hyperbaric medicine.
So why don't we head into that now? So
Okay.
why would we use, first of all, sounds awesome. And since you're going to take all these risks away by your careful mitigation, gosh, shouldn't it just treat everything? So what do we use hyperbaric oxygen for?
Well, typically what we use hyperbaric oxygen for is back in the beginning, they started using hyperbaric oxygen for a condition called the bends. And
I've heard of that because my dad was in the Navy.
Yes, and
Right.
that came from the Navy, and scientists scientists and doctors working with what's called decompression syndrome. And so what happened is back probably in the 1800s, you had divers that would dive and they would just come up too quickly. So
and in the 1800s they weren't diving for recreation. They were diving to build bridges, right? They were it was the Industrial Revolution, right?
Yes.
So
shipwrecks and stuff like that, salvage. So there was a lot of divers that either dove with a diving bell. So if you can imagine that they had a huge bell and they would lower that bell and the divers would go in there, take a breath, and then go back and do and work, and then they would go back and stick their head under that bell and breathe. And they would do that, and then then they
so
would
if they came up too quickly, what would happen then? Why do we call it the bends?
We call it the bends because, I was talking about oxygen and carbon dioxide. So we metabolize those two gases. Our bodies use them. But there's other gases called inert gases. And those inert gases are gases that our body doesn't use. It doesn't have any use for them. But we're breathing them in.
Right.
So,
you mentioned all this nitrogen.
Yeah.
You seem to be breathing a lot of it.
We're breathing a lot of nitrogen. And oxygen and carbon dioxide, they're nice.
They play well together.
They play well together.
And humans like them.
Yeah, they're kind of cousins, so they play well together. They, whenever the oxygen molecule jumps off the red blood cell, he says, "Hey," and he kind of high fives the carbon dioxide molecule, and he jumps on, and "Okay, I'll see you later," kind of like the clock in, clock out kind of guys. Well, you have nitrogen come along. And nitrogen isn't so nice. He can be tolerable, but he's not as nice as carbon dioxide and oxygen. So remember how when we put someone under pressure, we force those molecules into the bloodstream, right?
Right. They're smaller and they're getting diffused.
Yes.
A lot of places.
So when we start to decrease the pressure, when the treatment's over, we start to decrease it, and we do it slowly because we don't want to do it fast. Because if you do it too fast, you could rupture someone's lung. They could bust their eardrums from the inside out.
Right. But so these divers in the old times, they're in the diving bells, and then they're done. So they're like coming up real quickly.
Yeah, they just
or coming straight up.
Yeah.
So what happened to this little nitrogen bubbles in their body?
Yeah. So the nitrogen gets infused into the bloodstream just like the oxygen and the carbon dioxide. Well, as you start to decompress, the bubbles will start to form in the bloodstream. Now, oxygen and carbon dioxide don't. They wait until they get to the lungs before they form into bubbles. And it's what we call off-gassing. So they play nice. They will not form bubbles in the bloodstream. They wait till they get to the lungs to form back into a bubble so you can breathe those bubbles out. Nitrogen, on the other hand, doesn't play that way. So once you decompress, the bubble may form in the bloodstream or in the tissues.
Like in the joints.
In the joints.
Right?
Yeah,
so
wherever there's fluid.
Bubble in a joint sounds really painful. And
yes.
So the patient would be bent over because of that pain.
Yes, because
everything hurts. My knees, my back, my...
Right, because if you can imagine, the joints have all this little space in between the joints.
Right.
And there's fluid in there. And that
normally, yep.
And nitrogen can be saturated in there, and then if it just starts to form bubbles, it can cause the joints to bend. And that's why they called it the bends, because people would actually literally bend over. They would get into the fetal position.
Sounds very painful. Yes. Yeah. So that's why they called it
the bends. They didn't know what it was back then.
No, right.
Until research came later. Where in the late 1800s, early 1900s, especially World War II, is when doctors really started studying what's happening to these divers. Why are they getting sick? And they would get sick with neurological damage as well because of that nitrogen. It would form bubbles. They would have strokes, seizures, because the bubbles, if they form in the blood vessels, then it blocks and it occludes the blood flow, especially to the brain, and they would have strokes. And so they started seeing why this would happen, and a man named Haldane came up with kind of some dive tables to try to give divers a stop So you have to come up slowly. You can't come up quickly.
Right. So they figured that out.
They figured that
okay,
out.
well, we'll bring you up slower.
So when you go dive, you have to follow what's called a dive table, and if you want to dive safely.
Yeah.
So you dive down there, and then you come up, and then it'll tell you there'll be some stops.
Right, depending on how deep you are and how long you've been there.
Exactly.
Okay.
And what you're breathing.
Right.
So you'll have to stop and then wait for a few minutes and then come up and then wait a few minutes and on and on. So that can happen. That's the bends. So let's say a diver comes up too quick. Let's say there's a shark down there and the guy's 100
right, because it could happen even now. I know we talked about this back in the 1800s, yes. But the bend still happens, right?
Yeah, the bends was there, it's here now, and it'll be in the future.
Yes.
Yeah, it's
because humans do human things,
yes.
Right? Okay.
So if somebody's down there and they get spooked with a shark and they have to come up too quickly, they come up from 100 feet, within a minute or 2 minutes. That is very rapid ascent. So what they would have to do would get that diver and put that diver into a hyperbaric chamber and compress that diver back to 100 feet of seawater, where the depth is,
to make those molecules smaller again.
Make the
bubbles smaller.
Make the bubbles smaller. The nitrogen bubbles, put them back into the fluid,
right,
and then
back into the bloodstream. So then they can just breathe it out.
Yes, and then as you do it slowly, nitrogen would rather off gas in the lungs, but forced, it will just form a bubble. So they bring you up slowly and allow those bubbles to expand and in the lungs, and you breathe the nitrogen out.
Breathe it out.
Yes,
right.
yes.
Okay. So it's always been a treatment for the bends, and it remains a treatment for the bends this day. And so that's why if you look at a map of hyperbaric treatment centers, you'll see them all along the coast.
Along the coast.
It's necessary to be near folks who are diving.
It is
generally around the
There's
coast.
A big concentration of hyperbarics in Louisiana, in New Orleans, because there's a lot of offshore drilling that goes on. There's a lot of divers, professional divers that work on these rigs, work on ships, on pipes,
right, and recreational.
And
there's
recreational
out
too.
There,
So you'll see places in Mexico, in the Caribbean. You'll see places all along the coast that treat that decompression sickness.
Right. Okay. So that's a non-wound condition that hyperbaric oxygen therapy is used for. I'm from the Mid-Atlantic, the Northeast. Gets cold up there, so I'm familiar with using it for carbon monoxide poisoning.
Yes, carbon monoxide poisoning. So carbon monoxide, so we were talking about the metabolism of a cell. It takes a oxygen molecule and it metabolizes it, and the byproduct is carbon dioxide.
Right.
Well, when you have a fire, like let's say you're just burning wood in a barrel. It's kind of like a cell, that fire. The fire's going to use, let's say, wood as the fuel. It's going to use oxygen for the combustion.
Okay.
And then so it burns the wood. So the byproduct, there's going to be carbon dioxide. So carbon is...
Carbon monoxide?
Yes. Yeah, so
okay.
Yes, carbon dioxide and carbon monoxide too, but more carbon monoxide. So that's an incomplete combustion of a fuel, of a source. So carbon monoxide is a dangerous, poisonous gas. It's odorless, it's colorless, tasteless. You can't see it, can't smell it. So what happens is if you start breathing carbon monoxide in, it really, really, really loves red blood cells.
It competes, doesn't it?
Yes, it sure does. And the red blood cell really, 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 really loves carbon monoxide. So it'll bump off the two nice guys, and here comes carbon monoxide. And once it jumps onto that red blood cell, it locks onto that red blood cell, and it won't let go.
Right.
It will not let go.
It has such an affinity for it. Yeah, if the red blood cell has a choice between an oxygen molecule or a CO, it's going to choose the CO.
It's going to choose the CO every time.
They've got a big love affair, don't they?
So the more that you breathe...
So that's dangerous then. So then you have CO floating through your bloodstream instead of oxygen.
Yes. So what it's doing is it's choking you from the inside out. So you're breathing all this carbon monoxide or CO, and it's kicking off all the oxygen molecules, and it's like, a big gang of people at the at the roller coaster. They knock off all the people and they get on the roller coaster, and the management says, "Hey guys, you got to get off this roller coaster," and they say, "No, we're not."
They steal the roller coaster.
Steal the roller coaster.
They commandeered it. Yes.
All the cars are all taken up by this gang.
Right.
And they will not.
And
get
so
off.
your brain isn't getting oxygen. Your heart isn't getting oxygen. Yeah, that sounds really dangerous. That's why we lose so many people to carbon monoxide poisoning.
Right.
And I mentioned the Northeast. I mentioned colder climates because, we pull out our kerosene heaters. Yes. We shut the flue to our chimney, and all this. The pilot light goes out in our, just problems with anything with gases, gasoline, kerosene, natural gas furnaces. And if you don't have a carbon monoxide detector in your house, you're not going to know. And the symptoms are actually flu-like symptoms.
Right.
You're just tired, you don't feel right,
headache.
Feel achy. So what do? You go to bed.
Right.
You sleep it up. You go to bed.
Take some aspirin, go to bed.
The problem is you're not going to wake up in the morning
right.
because of this colorless, odorless gas. And so when you're found, which is hopefully sooner rather than later, hopefully you can be brought directly to a hyperbaric oxygen chamber.
Right.
And so how does hyperbarics work to get the carbon monoxide out of your bodies? It sounds very similar to treating the bends, to getting the nitrogen out. Right?
Yeah. So they'll put the person into a hyperbaric chamber, give them 100% oxygen, and that, number one, immediately puts oxygen molecules into the bloodstream.
That's right, because now
you don't need your red blood cells.
Right. Awesome. Okay,
right.
So the red blood cells can have the CO for a little bit because we're going to put oxygen directly into plasma.
Correct.
Which is going to your brain, going to your heart, going to all your tissues, keeping them vital, keeping them alive. Awesome.
Right. And then eventually the pressure will force the carbon monoxide off and the oxygen will...
Yeah, the CO, since you're not getting a dose of carbon monoxide anymore, so that'll just naturally do its own pathway, and when it gets off the inner tube, that's it. It's gone. And you're feeding oxygen back onto the inner tube. So that's how to recover from that carbon monoxide. That's fascinating. So, but how did we figure out that it helps wounds, though?
Well, it helps wounds because you have to kind of understand wounds. The majority of the wounds that are treated by hyperbaric oxygen therapy are diabetic wounds, and they're usually in the feet, sometimes in the hands. What happens with diabetes is it's a terrible disease, and that's where the blood sugar levels of patients with diabetes get too high. And we have insulin that's released by the pancreas, and that insulin helps the cell use the glucose or blood sugar.
Supposed to help regulate it,
yes,
right?
It regulates it. So in some people, their insulin just doesn't work anymore. They have insulin, it's just not effective. And in other people, they might not have enough.
They don't have enough of it. Okay.
Insulin.
Mm-hmm.
And so if the blood sugar levels remain high, the blood sugar level, the blood sugar in the body, in the bloodstream, can act like, I don't know, broken glass or something, and it can scratch the insides of the arteries, and that can cause damage. And over time, the blood vessels can become hardened, they can thicken, and they can become occluded by cholesterol, plaque, fat. Some blood vessels can get destroyed, the smaller ones, and when the smaller blood vessels get destroyed or occluded, then the tissues that are fed by those blood vessels no longer have sufficient circulation, blood flow.
And therefore, no longer sufficient oxygen.
No longer sufficient oxygen,
okay.
Yes. So then ulcers may start to form.
Right, if you accidentally scratch yourself or step on a rock, or sometimes they just spontaneously happen, right?
Yes, they spontaneously happen.
And there's not enough. So oxygen plays a role in healing. You need oxygen to heal a wound?
You need oxygen to heal a wound.
Okay.
So by putting someone in a hyperbaric chamber and forcing the oxygen into the bloodstream, now it's in the water part, the plasma.
That's right.
And it can get, wherever there's fluid, that oxygen can get. So sometimes it can get into the tissues where the healing needs to take place. And it can actually start to heal tissue. The body can, there's a process called angiogenesis, where blood vessels will start to form.
Ooh, here's another $10 word. Angiogenesis. angiogenesis. Okay, so angio meaning vessels, like arteries. Okay, and then genesis meaning birth or
Yes.
regrowth.
Right.
So a regrowth of blood vessels.
Right.
Angiogenesis. Hyperbarics does that.
Hyperbarics does that.
Fascinating.
Yeah. So,
Fascinating.
majority of the patients are treated are diabetics with diabetic wounds, and
In our center.
in our center, yes, in our
And
center,
might be because of where we live. We live in South Texas.
diabetes is very prevalent.
Okay, so it can take oxygen to the tissues. Check.
Yes.
It can grow new blood vessels.
Yes.
Angiogenesis.
Yes.
Awesome. Check. It can reduce edema, right?
Right.
Swelling of the tissues.
Yes, it can reduce edema. That's swelling.
Awesome.
It helps. It helps with collagen formation.
That's what our tissues are made of,
Our
right?
tissues are
Collagen.
made-
I've
yes.
heard of that. Okay.
It just helps the healing process in general. Just by giving the body the sufficient oxygen it needs.
Right. Well, all those things would help it, yes. And it can also help some white blood cells work better, right? So therefore it helps antibiotics work better.
Yes.
So sometimes we use it for certain infections along with the antibiotic. It's not a replacement for,
Right,
but along
right.
with the antibiotic to help cure that infection or reduce that infection.
Right.
Okay.
And there's all kinds of infections. There's infections in the tissues. There's infection in the bone that hyperbaric oxygen therapy can help.
Right. That's fascinating. Some infections are really bad and scary, and they need everything. They need surgery.
Yes.
They need antibiotics, and hyperbarics can help that too. Because
Right.
especially if they're a scary bacteria or a scary germ, and they're fast growing, and the surgeon goes in and takes out as much as he can, and then if we can supplement that with oxygen,
Right.
and the infectious disease doctor is giving the antibiotic.
Correct.
Right. So hyperbaric oxygen therapy use in wound care is considered adjunctive, right? Adjunctive. Can you explain what that means?
Adjunctive is a support to doing something. So, if you're going to paint a house, it's the paintbrush and the paint that's going to do it.
Right.
But how do you reach the eaves on the top of the house?
We'll get you some scaffolding.
Yeah,
Or a big
or
ladder.
ladder.
Okay.
So you need that hyperbaric therapy as an adjunctive to help the antibiotics and the surgery to heal.
Whereas when we use hyperbaric oxygen therapy for the bends or
Right.
for carbon monoxide poisoning, that is the primary
That's
treatment.
a primary treatment.
Right.
Exactly.
Right. There's no replacement for
Right.
it. Like it is the primary treatment.
It is
for
the
it.
primary treatment for
But
it.
in wound care, it's considered adjunctive.
Yes.
It's alongside with all the other principles of wound care. Okay. Oh my gosh, that's fascinating.
Yes.
It's just all right. Can we talk about then? So it helps diabetic wounds. It can help surgical wounds, right? So
Yes.
If a surgeon does surgery on a patient and we're worried that might not heal,
Right.
we can do that, right?
As an adjunctive therapy to help it heal.
Awesome.
There's also another indication that it can be used for. It's radionecrosis. So
Okay, this is a $15 word. Oh my gosh. Okay. So let me try this one. All right. Radio meaning radiation,
correct.
right? And then necrosis from the Greek necro meaning death. Okay, so tissue death because of radiation.
Tissue death because of radiation.
Radionecrosis.
Very well put.
So tissue death because of radiation. Okay. So these are folks that have had radiation for some reason.
Yes.
And usually on purpose, right?
Usually on
because
purpose.
they had a type of cancer or
Right.
something.
They had a type of cancer. So they've been exposed to radiation. It's usually many multiple treatments focused on one area of the body where there was a tumor, where there was cancer present. And so hopefully by treating the cancer with the radiation, it kills the cancer cells.
Right. Okay. So radiation is good. It can help
Yes.
treat and or cure cancer.
And it's getting better and better.
Right. We are getting
Yes.
better at it.
But sometimes that radiation can stay in the tissues and stay in the bone in the body.
Oh, it damages it.
It
right?
damages it, yeah, and it can stay there for a long time. And then over time, it could be years and maybe 10 years, 15 years later, ulcers, wounds may develop because of that radiation.
Right. Again, just kind of similar to diabetic wounds, because either a scratch or sometimes they just happen spontaneously. Because that tissue was damaged so many years ago from that radiation, it affects the circulation of it, the collagen of it, the collagen
Unfortunately,
synthesis.
with radiation, the doctors are trying to eradicate the cancer cells, but
Save a life.
yeah, but they eradicate good tissue and good cells with it. So
Right, because if, for example, if a patient has a cancer of a colon, right, and a doctor needs to give it radiation, they have to shoot through other tissues to get to that colon, right? Or say bladder cancer or prostate cancer, you have to shoot the radiation through other tissues of the body. So yes, it's getting to the tumor and killing it off, but unfortunately all those other tissues it's going through, the bladder or the colon, it's damaging it. Yes, it's damaging it. For women, jaw, the breast, the lymph nodes or soft tissues that it's going through to get to the breast tumor, it's damaging all those tissues it's going through. And the best way I can describe irradiated tissue, and I think you'll agree with me, is it feels like a rubber chicken cutlet.
Right.
It's so hard to describe, but it's like normally our soft tissues, when I press my finger onto a soft tissue on my body, my forearm or something, it's soft. It presses in and it's soft. But irradiated tissue is hard.
Rubbery.
It's almost always, rubbery. It's almost always pale.
Yeah, gray.
You can always tell it's different tissue. Sometimes just by looking at it, but definitely by feeling it, by touching it. And that's irradiated tissue. So if you get a scratch there or anything, if you rub it, your bra strap rubs it, your underwear strap, or whatever, and your body goes to heal it, it can't. It can't heal it, right?
No, because
it doesn't have the circulation, doesn't have the collagen synthesis, all those things needed for healing.
Tissues are damaged, and it happens over years, over time. And so the treatment is hyperbaric oxygen therapy. They put the patient in there, and they give them a high dose of oxygen to help supplement all those tissues to help the body heal where it was lacking in oxygen.
So it would help because it takes oxygen now through plasma. It doesn't even need red blood cells.
Right.
So it takes the oxygen through the plasma to that wound or that area. And then it also helps because of that angiogenesis, right? It's going to help grow new blood vessels in that area, which is what you need.
Right.
That's fascinating. That is awesome. Awesome. Radionecrosis can also happen in bone, right?
Yes. Osteoradionecrosis can happen.
Ooh, look at you adding another osteoradionecrosis.
Yeah, but I'm glad you're here to break the word down.
I love breaking words down.
My Greek's not too good.
Okay, so osteo, meaning bone.
Yes.
And then, of course, radiation and necrosis. Okay, so, wow. And this happens occasionally, especially like in the jaw, for folks who have had tongue, throat, any kind of oral cancer.
Thyroid cancer.
Yes, right. So they're shooting a radiation beam through their jaw to get to either the tongue, the base of the tongue, anywhere near the mouth, neck area. In fact, we've seen them further down the neck. But in doing so, again, it's the radiation beam is going through that bone, and it's the same thing. It's changing the tissue of the bone. Now, we don't see the bone. You and I aren't seeing the bone when it comes. Sure, surgeons might see the bone, or maxillofacial surgeon will see the bone itself, and they describe the bone as looking different. They say it looks like
they use MRI.
Imaging. Right, because you can tell right on an image that it looks different. The blood supply is gone, the marrow, very little or gone.
Right.
It's, again, all that tissue is changed because of the radiation. So, yes, hyperbaric oxygen therapy can help for that.
It can.
That's fascinating.
Adjunctive therapy.
Okay, so this is topical, and we did not realize this when we were planning our first podcast, but hyperbarics is in the news right now.
It is.
Because, a celebrity, Jay Leno, sustained some burns at home in his garage. So it sounds like he had some surgery, some grafting, and they're giving him hyperbaric oxygen therapy to help him recover and heal.
Right.
So in all those ways we talked about, it's delivering oxygen through the plasma
Through the plasma.
Awesome.
directly into the tissues to help the tissues rebuild collagen.
Awesome.
Also, it helps the macrophages to break down.
Yes, to fight infection.
Fight infections.
Right, because that's the last thing he needs is an infection on top of this. It's going to help reduce any swelling. Swelling and edema, that's just normal after a surgery, but it'll help keep that in check.
Right.
So that'll be good. And it can help him grow new blood vessels with the angiogenesis. That is fascinating. And I saw on, I think it was Inside Edition had a video of him he must have been in a monoplace because he was just laying in there himself. Okay, so monoplace chamber. And I saw he had a hospital gown on. And again, you'll see that his wounds were dressed. He had the gauze on his hands and on his head and on his face because the oxygen doesn't work by sinking into the wound, right?
It doesn't.
It works by him breathing it in.
Yeah, you have to breathe it in.
Okay.
Yeah, it doesn't really penetrate. You have to breathe it in.
Okay. And then it also showed the attendant. He was talking to the hyperbaric technologist next to him. So how do you communicate to a patient when they're in a monoplace chamber? Do you use charades or what do you?
You can. We do that a lot. We use charades, but no, there's a communication board on there with a telephone receiver. There's a speaker inside the chamber, and there's a microphone in there. So
okay, so they can hear you.
Yes.
When you talk, and then anytime they talk, you can hear them.
You can hear
because there's
them.
A microphone
right.
on in the chamber
in
all
the chamber,
time.
Yeah.
Okay.
You can, usually the chambers now are designed to where you can hook up a TV or music that can play through those speakers while the patient is in there. And if you pick up the phone, the receiver, then it mutes the TV noise, the background noise, and then you can speak.
So you can talk to the patient.
Yeah,
okay.
Directly to the patient.
And that's good. That way, like, if you need them to put on a mask for their air break, like we talked about, you can
directly talk to them.
Okay. If they're feeling hot or cold,
right.
They can let you know because there are some adjustments you can usually make, right?
Yeah, there's a flow rate that you can either speed up the oxygen that's flowing into the chamber or you can slow it down.
Okay.
And it's kind of like on an airplane when you overhead you have the little vents, the air conditioner vents.
Oh, right. Okay.
There's a couple of vents in there like that.
Gotcha. So TV or music. So how long is a patient in a chamber?
Usually the patient is in there for an hour and a half. They've done extensive studies throughout the years by putting people in there for many hours, days, and then they've shortened it. And it just seems to be that an hour and a half is the optimal time to be in a chamber because remember we talked about risks,
right?
And you don't want the risks to outweigh the rewards,
right?
So
you don't want oxygen toxicity.
You don't want oxygen
just for the sake of healing a wound. Like
exactly.
you want both. You want wound healing or graft healing or whatever. You want that, but you also don't want to have a seizure because you have oxygen toxicity. Okay. So it's a careful balance.
Right.
And again, the physician prescribes that, or the provider,
yes, the provider
would tell us exactly how long to give the treatment and how deep, so to speak, how much pressure to put on them.
Right, how much pressure to put on them.
Twice as much pressure or 2.5 times or 3 times as much pressure.
Right.
Okay.
And I'm speaking of healing wounds. So an hour and a half is the optimal time for wound healing. Mm-hmm. Now, carbon monoxide poisoning there may be different.
Very different.
Very different. Yes. I guess it depends on how much exposure to carbon monoxide someone.
Yeah, it's going to depend on their serum CO level for sure.
Exactly.
Yeah.
And also decompression sickness. Also, it depends on how deep the diver was and what they were breathing, how fast they came up, and that's variable. So.
And also for the bends and for CO poisoning, it's very often multiple treatments per day.
Right, it's multiple.
Because it's, the goal is to get that nitrogen out of them or get that carbon monoxide out of them. So you do it 2 or 3 times a day for a very short time, though. Like they only need it for a day or 2 again, days. Depending on how much they had in them and how quickly they can recover. Whereas for wound healing, we're looking at a lot longer course, right? What's the typical, how often do they, is it once a day? Is it 3 times a week? Or how often does a wound care patient generally attend?
A wound care patient generally attends once a day for an hour and a half, and it's every day. Typically in a wound care center, outpatient wound care center, it would be a Monday through Friday.
Okay,
and
5 days a week?
5 days a week.
Okay.
And it's usually 20 treatments, a minimum of 20 treatments to heal a wound.
Okay,
Sometimes,
that's about 4 weeks.
Yeah, it's about 4 weeks.
That's a lot. That's
Yeah.
a big commitment.
And it can be extended to 6 weeks. So it just depends on the person, on how well they're responding. Some people heal in less time than the 4 weeks.
Right. Everybody's
different.
It's individualized.
Right.
Yeah. So if they heal faster, we'll stop the treatment.
Right. You can stop the treatment.
If it's taken them longer, we might consider extending it.
Yes.
It sounds like, though, for like the radio necrosis, it sounds like because of all the tissue damage done by that radiation, sounds like it would take longer, though, than just 4 weeks,
yeah.
right?
It usually takes about 2 months for them.
8
weeks.
About 8 up to 12 weeks for that.
Yeah.
Yeah. Okay. That all makes sense. So let's talk about billing. Let's talk about charges. Does insurance pay for this? Gosh, I hope so.
Yes, it does.
Sounds expensive.
It is expensive, and a lot of hyperbaric centers would be out of business if insurance didn't pay for it.
Good
but
point.
there's a catch.
Uh-oh.
There's only certain illnesses or diagnoses that are covered at this time. So that would be for diabetic foot ulcers, and there's some stipulations there for the radionecrosis.
Okay.
And there's other conditions that may not be covered, like multiple sclerosis, of course, seizures, things like that are not approved as of yet. So you just have to check with your insurance carrier to see what is approved and what's not approved.
Right, because Medicare or CMS,
Right.
Those are the indications we're talking about.
That's the indications we're talking
Because
about.
very often, here in the United States, CMS sets their guidelines, and then very often, private insurances simply follow those guidelines. Why rewrite the rules, right? But some private companies decide differently.
Yeah.
And they will cover a certain diagnosis or indication, whereas Medicare or
may
CMS
not.
won't.
Yeah.
So we don't know until we ask that person's insurance company with their plan.
Right.
Right. Because of course the insurance plans differ too. Right.
They do.
So if you have Plan A versus Plan C, one might be covered and one might not. That's.
It can get complicated.
It sure can. If a patient doesn't have insurance or the insurance doesn't cover a hyperbaric oxygen therapy and they want to do it, how much would it cost? Just cash? Can I just pay cash?
You can, and that depends on the hospital. How much the hospital is going to charge you depends on that hospital. So you would have to broker a deal with the hospital. But
okay, and that's if the hyperbaric center is linked to a hospital.
That's
which not all of them are.
Not
Some
all
of them
of them
are standalone.
Yeah.
And so then you would just obviously deal with the bosses or the
doctor,
the standalone.
the company that's running that unit, that center.
And some, I know some centers take, like care credit, they take credit cards. And so it really does vary. So you mentioned multiple sclerosis. So there are other diseases and conditions that hyperbaric oxygen therapy is being researched on and being used for. I know I've seen headlines that local military places are trying it out for PTSD for our troops. So there are other things that hyperbaric oxygen therapy might help. And fortunately, there's researchers out there researching it, right?
Right.
So hopefully coming down the pike, we'll see more covered indications, right?
Right. And right now, cancer is not an approved therapy through Medicare, but there is research going on in the effects of trying to help cure cancer or put it into remission.
That would be awesome. Yeah, because some cancers, certain kind of cancers don't like oxygen.
No.
They die off in an oxygen environment. So
Right.
it just makes sense that hyperbaric oxygen therapy might be beneficial for that type of cancer. Again, not all cancers, but for, that type of cancer. That's fascinating. So there's research being done on that.
Yes, and who knows? There may be through research that they do find out that hyperbarics does treat more than what it's been treating, because this research has started in the 1800s, and here we are 150 some odd years later, and the research is going on. So
yeah, but we still only have like 13 indications
Right.
that Medicare will pay for
or
anyway.
Medicare will pay for.
It's not a glamorous therapy, so it's not. And up till a week ago, there weren't very many celebrities out there
No.
that had a problem that needed it. So I'll be honest, there's not a lot of money being thrown into hyperbaric oxygen research. Of course, with more press, with more education, and just getting the word out, maybe more research can be done.
Yes.
More money thrown their way so that more research can be done so that it can help folks. I've heard about it being researched for cerebral palsy, stroke patients, cancer,
Right.
like you mentioned, PTSD, multiple sclerosis. I mean, you name it. It's certainly been thought of,
Right.
if not certainly being researched right now.
And you have to be careful with hyperbarics, because there's a lot of what's called off-label. You were talking about a standalone clinic. So these are clinics that are either in a building by themselves, or they're in a strip mall. They can be using any type of hyperbaric chamber. Sometimes there's these inflatable zipper bags that people get into, and even though the FDA has approved them, the evidence just doesn't show that it can deliver the amount of pressure that a solid hyperbaric chamber can.
Right, because the FDA has approved these inflatable devices for altitude sickness only.
Correct.
With use of air.
Right.
It has not approved them to be used with oxygen running through them.
Right.
But unfortunately, folks they're trying to be their own mad scientist and say, "Oh, I have the hyperbaric with the pressure, and I think I'll just hook up oxygen to it, and I can do what I heard doctors are doing," and that can get a little dangerous, right?
Right.
Very dangerous.
It
yes.
can. And hyperbaric oxygen therapy it's a highly regulated industry. There's a lot of laws. We follow all kinds of laws.
Because you and I work in a wound clinic that is attached to a hospital.
Correct.
So we are under the auspices of all the government regulators, and we are certified by the Undersea Hyperbaric Medical Society,
Right.
HMS. So we follow all these rules and regulations, and we do, because we're hospital-based, we do only treat the indications that, again, that CMS or Medicare has approved. So we, in our wound clinic, don't do off-label, and we don't do research
Right.
in our wound clinic. So, but yes, there are private standalone clinics that do off-label. But I think what you're getting at is be careful.
Be careful.
Make
yeah.
sure they're following safe practices. I would hope that they follow all the safe guidelines that the Undersea and Hyperbaric Medical Society puts out.
Yeah, there's also the National Fire Protection Association.
Ooh, the NFPA.
Yes, that when you're dealing with oxygen, it's risky. So
or any gas, really. So the NFPA has a lot of safety guidelines for how to deal with gas cylinders, gas piping, all of that.
Right.
All of that.
So just do your homework. There has to be a licensed physician on site at all times when hyperbaric oxygen therapy is being administered, and you just have to ask questions. And if your spidey
because
senses,
again, the risks
yes.
are so high.
Right.
A patient could get injured in a hyperbaric
they
chamber.
could get killed.
So it's important to have trained staff, highly trained staff.
Yes.
We are required to have a safety director.
Yes.
So we have a safety director at our facility. We follow all the safety guidelines.
We have to go to classes, continuing education.
Right. But it's more than just the patients that can get hurt. It's the attendants. It's our staff too,
Staff
right?
can get
because
hurt.
if a fire happens, or God forbid an explosion or
Yes.
something, we're all at risk,
Right.
right? So there's a lot of safety involved with
Right.
hyperbaric oxygen therapy. So
So that's why you just don't see hyperbaric chambers in people's houses. It's
I would hope not. Yes.
right.
Yeah.
It certainly can help, and it's good, but sometimes it can't be the cure all or
Right. It's not a panacea.
Right.
It doesn't cure everything. Like anything in medicine.
Exactly.
There's no 100% guarantee. We do not have a 100% healing rate
Right.
with our hyperbaric oxygen therapy. It helps a lot of people.
It does.
It does not help all of them.
No.
It's like anything in medicine. I remember seeing a photo of Michael Jackson in a chamber, right?
Right.
So I think he was, at the time, he was touring a burn clinic. And they
They put him in there.
Yeah,
in
he either said,
photo op
I want
or-
to see what it's like, or,
Yeah.
or they offered, you want to see what it's like. So they put him in the chamber. And I always thought it was funny because he's in there, of course, in his full Michael Jackson regalia. He's
Yes.
got his glove on and his
Jacket
sequin
and
jacket
everything.
and talk about all the fire risks. And I thought that was interesting.
So there's a couple of fun facts about hyperbarics.
Ooh, awesome. I love fun facts.
When do you think the first hyperbaric chamber was invented?
Well, I would say in the 20th century, right? Because it seems so newish. Like, I'd say in the 1900s.
Nope.
What?
No.
When?
It was in the 1600s.
What?
Yes. It was in the 1600s
Oh my gosh.
by an English physician that built the first hyperbaric chamber, and it was called the domicilium. Let's see, 1662.
Oh, I
So,
love it. Oh my
yeah.
gosh.
Been around for a long time. It was just a big metal container that was built, and it was pressurized by using bellows. They used big, huge bellows.
Oh my god.
I guess they just wanted to see what it would be like to compress someone or compress air in this thing.
Okay, so they were using air. 'Cause
Yeah,
they're
they
just
were
using
using air. Yeah,
bellows.
bellows.
They're just okay.
Yeah, and so that was
Well, they wouldn't even know because they wouldn't even know about oxygen
Right.
back in the 1600s. Okay. Oh my gosh, that's fascinating.
Yeah, so it's been around for a long time, but only kind of in the modern era, in the 40s and in the 50s is when the research for healing started.
Right,
So,
right. Okay. One of my favorite hyperbaric researches was done, I think in the 1960s by Dr. Berme.
Uh-huh.
Okay, and can I explain this a little
Yeah,
bit?
go ahead.
I love this one. Okay, so trigger warning, I am going to discuss some animal research. So if you don't care to hear about that, go ahead and skip ahead about 2 minutes. But yeah, I think this was in the 1960s. Oh, I should have done better research. Or 50s maybe?
It was in 1959.
Close enough. All right, I was a year off, 1959. Dr. Baramea. And so what he did was he put some pigs, again, animal research, he put some pigs in a hyperbaric chamber and compressed it, of course, and they're fine. They're just all squeaking and happy. But he wanted to prove that it worked because of the red blood cells. So he hooked them up to machines that, kind of like a dialysis machine or a plasma machine, that took out their red blood cells. So he took out their red blood cells, gave the plasma back to them, just kind of spun it back into them. So the pigs stayed alive. They're perfectly fine. So these pigs, he took out almost all of their red blood cells, and they were squealing and happy and fine without red blood cells.
That's crazy.
That's like, it just blows my mind.
He took the lifeblood out of them.
Literally. Yes, because we all need red blood cells.
We do.
We talked about that. We talked about anemia and how tired you feel
Right.
and how short of breath. But no, these pigs were squealing like they're in mud. They're happy as pigs in mud, right? So he proved that hyperbaric oxygen therapy works without red blood cells.
Right.
It works simply by diffusing lots of oxygen into your plasma, and you can be happy as a pig in mud in a chamber. Now, the sad part is that when they, took them out of the compression chamber, the pigs died, of course, because they had no red blood cells, and so they essentially suffocated. So that's the sad part. But again, that's so Burmese pigs. His study was called Life Without Blood, and that's how we helped figure out how hyperbaric oxygen works. I think it's fascinating. I love that. Cool. So wow, we've talked a lot about physics, biochemistry, history. Oh my gosh.
Right? Big words.
Yes, big time. We learned new words today. Angiogenesis, radionecrosis, osteoradionecrosis, hyperbaric. We learned a lot of $10 words.
Right.
So, how did you get into hyperbarics? Like, what did you grow up think, I want to be a hyperbaric tech when I grow up?
Not
how did you
at
get
all.
into it?
I had no idea about hyperbarics. I went through nursing school. I became a nurse. I was out in the field. I was doing home health nursing. I worked at a nursing home. And then I guess I had been a nurse for probably about 11 years.
So let me stop you there. So do you remember, and we're going to go a little way back, when you were in nursing school, did you learn about hyperbaric oxygen therapy?
I did not learn about hyperbaric oxygen therapy.
And mind you, I'm going to go ahead and date us. We went to nursing school in the 90s.
Yes,
okay.
yes.
All right. So all right. So you didn't learn about it in nursing
No.
school, and became a nurse.
I became
11
a nurse.
years later.
Yeah, about 11, 12 years later, I got burned out. I wanted to do something else. I just didn't want to be a nurse anymore.
Okay. Well, that's topical because that's happening right now to a lot of us. Okay. All right. So you're feeling the burnout.
Yeah, I got burned out in nursing, so I jumped to DME. So I started
DME.
Durable medical equipment.
Oh, okay.
So
Okay, so you're going to sell things.
sell
now.
things.
Oh,
like,
well, that's a jump.
Yes,
okay.
it was a jump. So the company that I went to work for, they put me selling diabetic shoes
Okay.
to diabetics.
All right.
So
Well, that's
since
not a big jump then. Okay. So
Yeah.
from being a nurse to selling diabetic shoes.
Right. So because of my nursing experience.
Yeah, right.
With diabetics. So I started going, calling on doctors' offices and other clinics and senior centers and talking with people about diabetic shoes, inserts, custom diabetic stuff. So I happened to run into someone. I was at lunch and I ran into someone, and I thought he was a physician. He just looked like a doctor. So I just approached him, and when you're in sales, you have to talk to everybody.
Right. I could never be in sales.
Right. So I started talking to him in line, and he said, "No, I'm not a doctor. I'm a hyperbaric tech." And I was like, "Hyperbaric tech? What's that?" And so he started saying, "Well, yeah, I work at a wound care center, and we have some chambers." And I was like, he's like, "Yeah, you ought to come by our clinic." And he gave me his card and said, "Yeah, you need to come by and meet the director." And I said, "Oh, okay, sure." And so
Another great place to sell your shoes.
Right?
All right.
That's
right.
exactly what I was thinking. Like, here, I'm getting my foot in the door in a wound care center where there's diabetic wounds and people need
That's
diabetic.
low-hanging fruit right there.
Low-hanging fruit. So a couple of days later, I went into this clinic, and I saw him, the tech, and he greeted me and introduced me to the director. And lo and behold, I walked through the HBO unit.
Oh,
and
so you got to see
I got to see chambers
Okay.
for the first time. And I never really seen a hyperbaric chamber before. And there was like 3 of them with patients in them, and I was just flabbergasted. I was like, wow, that is so cool. What are they doing to those patients?
Right.
So when I went into the director's office, sat down, talked with him, gave him my whole diabetic spiel.
Right, you're still on the selling,
And then I put everything back in the briefcase, and I said, by the way, are you guys hiring?
Oh my God.
And
weird flex, but okay.
yes, right. Like my burnout went away real quick.
Right.
And he said, no, not at the moment, but you feel free to leave your you could fill out an application or leave your resume. We'll get back to you. Okay. So that kind of piqued my interest. And really, up until then, I had very little wound care experience. So,
okay.
So saline gauze,
right, wet to dry,
wet to dry. That was it.
Right.
Maybe an antibiotic ointment.
Right.
And that was it.
That was advanced wound care.
That was advanced wound care. And so I went back to home health nursing, and then about a year later, I got a call. Hey, are you still interested in working wound care? Wow. I said, I sure am.
Oh, wow.
When can I be there?
Wow.
And so I went to work. I was there for about a week, and then this redhead walks in the door.
Watch out for those redheads.
And
so that's when we met.
Yeah.
The rest is history.
The rest is history.
That's fascinating. Oh, my gosh. So how I got into it was I was similar story. Been a nurse over a decade and done everything just like you. I was a nurse aide. I was worked in a nursing home, assistant DON at that nursing home, and then I switched courses. I went and worked in a hospital, and I loved it. It was a ortho neuro trauma floor. I loved it. It was fascinating.
Wow.
I loved it. But it was second shift. It was 3 p.m. to 11 p.m.
Oh, nice.
And as you know, I'm a single mom.
Yeah.
And that's rough. It's rough if you're not a mom, but it's really rough if you're a single mom and you're trying to handle the childcare and school and all that.
How can you do that?
So I'll be honest, the way I got into wound care and then, of course, hyperbarics was because I wanted a daylight job. I just wanted a daylight shift. So this position opened up in the hospital, and it was for the wound ostomy hyperbaric team, and I applied for it. I didn't think I'd get it. I think I'd been at the hospital a year. I didn't have seniority at all. I did not think I'd get it. I went down to interview. And I did have wound care experience because of my experience in the nursing home. A lot of wound care experience, a lot of ostomy experience, and willing to learn about the hyperbarics. Right. So I got my daylight job, yay! And started to learn about the hyperbarics, and then moved here to Texas. Oh yeah, again, just fascinating. For me, it's seeing a patient come with a really horrible wound that even now I think, oh my gosh, how is this going to heal? And then watching the progression and the healing and the whole course, and then helping that patient heal their wound. It's so rewarding.
It is rewarding.
It's amazing. But there's a lot of training involved with hyperbarics, right? So initially we had a 40-hour course.
Right.
That was required. And then, let me think, I think I had to work in it a year, right, before I could even test, right? You have to work in it so many hours, right? And then you go and take this big national certifying test and exam, and you pray you pass, and then you pass. But to maintain that certification, then you and we have to get continued education. Every couple of years, so many credits, or so many hours worth, and
some of those credits they have to be directly related with hyperbarics,
specifically in hyperbarics. Yeah,
you can't just go take a geriatric course here and there, and
right.
No, it's got to be an approved course,
right? Which is cool because hyperbarics is always changing, like anything in medicine,
yes,
right?
It is.
We learn how to do it better, more efficient, more safely, all that, all the adjectives. It's constantly improving.
It is.
And so by doing our continuing education, we're learning that. We're learning how to improve, do it better, more efficiently, more comfortably, better healing rates, all that. We keep learning and learning and learning about it. Never stop learning, right?
Right.
That's fascinating. All right, sources. What sources did you use for today's information?
I used the National Institute of Health in NIH.gov that has a lot of good resources on hyperbaric medicine.
That's a great site. And I do like that the NIH.gov, it's written for lay people. You can read, you don't need to be a nurse or a doctor to read that website. It's very well written, and it explains about the history of hyperbarics, the uses of it, and a lot, just like we talked about today.
Right.
Any other sources?
And tied in with the NIH.gov is also the National Library of Medicine.
Okay.
And you can if you go to the National Institute of Health, you can click on the National Library of Medicines, and they have a lot of different studies and reports that they put out.
Okay, if you like to read that kind of thing.
Yeah.
Awesome.
The National Center for Biotechnology Information is also embedded in the National Institute of Health.
Okay.
So that is good. Also, mayoclinic.org.
Yes, I love this. Now, talking about resources, so this is what good for patients to read, or their loved ones or visitors when, and I use it for a lot more than just hyperbaric oxygen, but when I tell a patient to search somewhere online, I often use mayoclinic.org. All of these big hospitals, mayoclinic.org, Johns Hopkins, hopkinsmedicine.org, Cleveland Clinic, they've got great education on their websites, and they're researched, they're established, these are science-based. They're not trying to sell you anything, right?
No.
This is science just giving you information.
Published papers are on there.
Yes, science-based evidence. Awesome.
FDA.gov.
That's a good one.
Food and Drug Administration, because we're regulated under the FDA. So
right. Well, we're using oxygen as a drug,
right?
So yeah, we fall under the FDA auspices. Yeah, that's a great site, FDA.gov. Great. Okay. All right, we're going to wrap up here. One last question. If there was a movie, all right, we're going to make a movie about you, Patrick Escamilla. If there's a movie about you, which celebrity would you like to play you?
Ooh, I would think, Harrison Ford.
Oh, that's awesome. I would love that.
Yeah.
That's great. He's got the gravitas, the wisdom. Oh, I love it. I love it. And like you, he could stand there with a smirk and, say something that would just make you fall down laughing. That's awesome. That's perfect.
The hat, the whip, and the gun.
Love it. That's awesome. All right. Thank you so much for coming on my first podcast. I'm so excited. Thank you.
Yay.
All right, cool. Folks, this podcast was recorded in San Antonio, Texas in November of 2022. It was developed, edited, and written by yours truly, Wound Care Karen, and I did it all while wearing a comfortable pair of shoes. The views expressed here belong to me and my guest, and not our employers or affiliates. If you like what you heard, please subscribe and give me a 5-star review. If you have ideas for future podcast content, please drop me a line at contact@woundcarekaren.com or message me on Facebook, Instagram, or YouTube. I'm Wound Care Karen, and please remember, folks, time does not heal all wounds. So if that happens to you, please seek help from a wound care professional.